My name is Thomas Brassard, and I'm with Exercise as Medicine at the University of Ottawa. And joining me today is Tami Morgan, a PhD candidate in knowledge translation tools for curriculum renewal and health promotion at Queen's University. Tami's MA research focused on mental health, burnout, physical activity, and sedentary behavior in medical students. Her PhD research focuses on the dissemination and implementation of the 24-hour movement guidelines for adults in medical education and practice. So without further ado, I'd like to welcome Tami Morgan. Tami?
Thanks so much for having me, Thomas. I was really excited to get this invite to do an interview, not only for Exercise as Medicine Canada, but just about the specific topics that you want to talk about, like the 24-hour movement guidelines and student health and burnout and all that. So thanks so much for having me. It's
Thank you
a
so
pleasure.
much. Thanks for joining us. So to begin, maybe if you could tell us a bit more about your research and even the 24-hour movement guidelines and their importance in maintaining good health.
For sure, yeah. So I started my PhD here at Queen's University in 2019. Got a little bit of time in just before the pandemic hit. And my work has largely focused on the 24-hour movement guidelines for adults, which were released in October 2020, and how we can best disseminate and implement those guidelines among medical students. So working with the medical school here at Queen's. And then more recently, my research has focused on how we can implement these guidelines among current healthcare providers in Canada. So that's just a quick summary, but we can go definitely into more detail.
Sure. Yeah. Oh, yeah. We'll definitely dive into it a bit more later on. So with the 24-hour movement guidelines, there's different categories based on different age groups, correct?
Yes.
Okay. And so it varies with movement, sedentary movement or sedentary behavior, and sleep as well, right?
Yeah, so there's actually 4 different guidelines that have been developed, and they have different recommendations for the age categories. So we have the 24-hour movement guidelines for the early years. So that's from ages 0 up to 4 years old. And then we have the 24-hour movement guidelines for children and youth, which is ages 5 to 17. Then we get into the adult recommendations, 18 to 64, and for adults, 65 plus. And so the recommendations for adults and adults 65 plus are relatively the same, with the exception of the sleep recommendations are different for adults 65 plus, and they're also recommended to do some balance activities. But the guidelines for physical activity, sedentary behavior, and sleep, those recommendations are quite different for the early years and children and youth. Basically, they need way less sedentary behavior and way more physical activity than we do as adults. And so the specifics of those guidelines can be found on the csepguidelines.ca website. I won't belabor those recommendations and the bullet points here in this video, but yeah.
We pushed more towards like online learning. And I guess a big concern is that a lot of students are sitting at their desk most of the day. I mean, even with like COVID could possibly increase that. Have you done any research on an increase in sedentary movement or any kind of implications on the 24-hour movement guidelines for students as COVID kind of pushed for e-learning?
Yeah, so my research that I'm working on has not kind of gone into this area on what are the impacts of the COVID-19 pandemic on sedentary behavior of university students, but certainly a lot of others have. So we're fortunate to have their research to talk about. Okay. So certainly there has been an impact on students' sedentary behavior as a result of the pandemic. You know, we're online and at home most of the time, and that's largely replaced sort of the active commute or incidental physical activity that we have, and we're replacing that with more sedentary behavior. So instead of waking up and walking to class or biking to class, or even walking to the bus stop to bus to class if you live off campus, we're just waking up and walking into the next room to our computers. So we've lost a lot of that sort of incidental active commute type of physical activity, and certainly have become a bit more sedentary as a result. In terms of like taking classes online, it's interesting because it really is more that in-between time between classes that's changed. So we don't have to walk between different buildings to go to our lectures. We can even just stay on our laptop the entire time, you know, from class to class, just jumping between Zoom meetings. So that's really the time that's changed. If you think about attending an online class versus attending a class in person, it's almost the same in that you are sitting the whole time, either watching a screen, that would be the main difference, instead of watching someone lecture at the front of the room. And if you think about it that way, because we're at home and we're not around everyone else in a lecture hall, we actually do have a bit more control over our behaviors during our online lectures. So that would be something interesting to talk about. I don't want to get ahead, and I think at some point you do want to talk about maybe tips that students could incorporate into their lives for the 24-hour movement guidelines being online. But overall, that's kind of how our sedentary behavior and some of our 24-hour movement guideline habits have changed as a result of the pandemic and online learning.
Yeah, I didn't even, I mean, yeah, you kind of have to take into account for like the in between classes. Like I remember in first year, to have a 10-minute slot to boogie from one end of campus to the other. And like, that's huge, I guess. Right. So,
yeah.
But yeah, so with this online learning, do you recommend anything for university students to better implement the 24-hour movement guidelines?
Yeah, so I have written down quite a few tips here. I always like to go more tips than fewer tips because I find, you know, you just throw everything out there and see what sticks with people. So in terms of during classes, like I mentioned, we actually do have a bit more flexibility because with online classes, because we're not being watched by other students, or the teacher at the front of class is not, you know, telling everyone to get back in their seats if they're standing and stretching and distracting others. So we can actually do these things a bit more freely with online class. So, you know, if you still have those longer classes, like 2-3 hour lectures online, they usually come with a break halfway through, hopefully still in the online format, they're still doing that. And at that point, you know, being at home, it can be easy to just stay in our seat and not move. But really trying to actually use that as a break to get up, get out of your seat, walk around for those 10-15 minutes that you have when you grab a snack or grab a drink of water. So I think that's really important. But even better if you can find more regular moments throughout those longer online classes, maybe where you can't actually get away from your screen, but if you can have something that reminds you, either a timer or a certain point in your class, to stand up or to stretch, move around a bit, so that you're not just sitting in one spot the whole time. Or even better, and I put this last because it maybe can be the hardest to implement, even better if you can try to stand for the whole class, or for the first half of the class or the second half of the class, or pace around while you're watching your lecture. I like to kind of shift back and forth, or even have like a stool in front of me or a chair, so I can alternate like putting legs up and down, so it's a bit less straining on my lower back, and that helps me stand for longer periods of time. But I mean, I think that would be ideal for everyone to do. I know it's hard to implement when we're so used to sitting all the time. And then I have a lot more tips for like in between class and physical activity and sleep that I do want to mention. Actually, first, before I forget, because, you know, we're on our screens all the time, not only is it important to move our bodies so we're not sedentary all the time, but also to look away from the screen, because screen time can impact your eyesight in terms of like feeling more fatigued and getting headaches. In addition to, it can disrupt your sleep if we get too much screen time, especially later in the day. So here the 20-20-20 rule is really helpful. So basically every 20 minutes, if you can look away from your screen for at least 20 seconds at something that's about 20 feet away, feet or meters. I think it's feet. That's helpful to kind of not put so much strain on your eyes. So maybe not as useful during class, but if you're working on your laptop and you actually can look away from your screen, that can be something that's also really helpful to break up that screen time, which is also one of the recommendations of the 24-hour movement guidelines, is to kind of reduce our screen time. In terms of between classes, I have some tips. So if you have a shorter break, like between 10 minutes to an hour, maybe I would consider a shorter break. Instead of just staying on your laptop in between classes, if you can get up, go for a short walk, even if it's only 5 or 10 minutes, just get out of the house, get out of the room that you were in to, get a change of pace, get some movement in, and that can help you refocus when you do return to your screen later on. For longer breaks, if you can maybe even do longer physical activity, so maybe getting some more moderate to vigorous physical activity, if you can go out for a longer, brisker walk, or go to the gym, go to a yoga class, or whatever else you enjoy. Because that's also really important, is not just to break up our sedentary time, but how can we incorporate more movement into our day that's a bit more moderate intensity, sometimes more vigorous. And that's also really important in an online context during the pandemic, when some of our physical activity behaviors have also declined. So that's, I would say, maybe a good time to do in between classes if you have a longer break. And then for sleep, it can be hard to get good sleep and have good sleep hygiene practices being at home. I know it's quite common for students who have like an 8:30 a.m. class to just, roll over in bed, turn on the laptop, and kind of stay with your camera off, tucked under the sheets. I totally understand that. And I honestly, no judgment at all. I would do that if I had an 8:30 a.m. class. But if you can, it can be really helpful to, when you wake up, get up out of bed, go to a different room, go somewhere that's bright to try and reset your body, your circadian rhythm, and help with your production of melatonin. It's important to get light early in the day and have dark later in the day to have proper melatonin production, which can be is needed for good sleep. So I would say, sleep has definitely been impacted with online learning, and that can be a good tip. Do try to get up out of bed and reduce screens in bed at all to a minimum, if not zero, if possible.
Yeah, try to kickstart the day with a little bit of activity just to, get moving and get your mind going.
For sure, yeah.
Yeah, it's really interesting how sleep plays a huge role in learning as well, right? Like your brain is trying to figure everything out while the body's resting. So
exactly. Yeah, you kind of consolidate what you've absorbed that day in your brain while you're sleeping. And so if you're getting less sleep, then that can affect your memory and your learning, for sure.
So how much sleep is recommended for students then?
So students, most students would fall into the adult category, so 18 years of age or older. And so you do need about 7 to 9 hours of sleep per day. Sleep is actually, of the 3 movement behaviors, the most challenging for the university student population, which is unsurprising. I mean, schedules are all over the place. You don't pick when your classes are, and you kind of just have to deal with it. And usually with those types of schedules and having to study and do homework and projects, sleep just kind of goes out the window. So ideally, if you can get at least 7 hours per day, up to 9 hours per day, that would be great. And you can incorporate naps as well. If you are good at napping, I'm not, I can't do that. But if you like to nap, then like a short, maybe 20-30 minute nap in the middle of the day or mid-afternoon is usually when it is most needed, can be helpful. And something that people don't realize is that we should actually have the same bedtimes and the same wake up times every day, which includes weekends, which is also very hard to implement when you're a student. And you often, some students pull all-nighters, which is really not a good idea, but I know that happens. And with classes all week, you usually want to see their friends on the weekend and stay up a bit later. But if possible, if you can try to keep those wake up and bedtimes as consistent as possible 7 days a week, that can help you regulate your sleep and have it more likely that you can get enough good quality sleep every day.
So kind of want to segue into burnout. And so, because I know your master's thesis, it had to do about burnout with medical students. And I was wondering, so is there any correlation between the 24-hour movement guidelines and burnout among students?
Yeah, so my research examined physical activity and also looked at sedentary behavior in relation to medical students' burnout. So I can't speak to sleep in terms of my research, but what my research found was that medical students who reported doing more light physical activity or more mild physical activity also reported less burnout. So it's cross-sectional, so the research that I did in my master's, so we can't necessarily say that doing more light physical activity will reduce burnout. It could also be that students who weren't burned out just happened to do more light physical activity because maybe they had more energy for it. They found it helpful to stay at a low level of burnout. So it seems from the research that I did in my master's that sort of these more gentle forms of physical activity or restorative forms of physical activity that are lighter and not as maybe taxing on our bodies can be helpful for burnout. So burnout is when you feel, there's 3 components. So it's emotional exhaustion. You just feel completely spent emotionally. There's also depersonalization, which can also be called cynicism. So you just feel sort of negative and cynical about your situation, maybe about other people around you, maybe about patients in the context of medical students and medical professionals. And then the third component is a lack of personal accomplishment. So you just feel like you're not achieving sort of what you want to achieve. So those are the 3 components of burnout. And so if someone's experiencing burnout, maybe doing more moderate to vigorous physical activity might not always be beneficial. There definitely is research that has shown that just physical activity in general is beneficial for burnout. It's good for so many things, but maybe the lighter forms of physical activity was more of like having a break from their extremely busy and stressful schedules. And then what we found for sedentary behavior was actually that medical students who reported sitting more hours per day were also reporting less burnout. So it's a bit of a different relationship that we found in terms of, for our physical health, we want to be less sedentary. But for medical students, at least in my sample from my research, they reported sitting more being related to less burnout. And again, we don't know, there's no causation there. We don't know if that, that actually causes less burnout. And it could also be linked to their year of study. Third-year medical students who are the most burned out typically of all 4 years of medical school. That's when they start their clerkship. And in clerkship, you're on your feet all the time. You're in the hospital, you're sitting less. So that could also explain the relationship that we found. But yeah, it's pretty interesting stuff.
Yeah. So does your research suggest any factors or like accumulation of factors that may increase burnout?
So my research can't really point to what increases burnout, given that it was cross-sectional, but we did find some demographic predictors that were associated with higher levels of burnout in medical students. So medical students who were female reported higher levels of burnout, and that's consistent with other literature in the area. As well, like I just mentioned, medical students who were in their 3rd year, actually, as well as in their 4th year, identified higher levels of burnout. So again, those are the medical students who are in their clerkship. They have different responsibilities that they have to adapt to, working in hospital settings. Those settings can also come with more stressful situations, like having to deal face-to-face with patients, maybe even witnessing patient death. So that could be linked to higher burnout. And then we also found that medical students who, so we had multiple sort of categories for them to self-report their ethnicity. And we found that those who selected the other category and sort of wrote in their ethnicity, which didn't fit the 5 or 6 or however many boxes we had, that category collectively also reported significantly higher burnout than the rest of, or sorry, compared to white medical students. So there again, we don't exactly know what's going on, but it could be medical students who feel maybe like an outsider to the dominant groups at that school, feel more of that sense of isolation, and that could put them at a higher risk for burnout. So there's certainly research that has been conducted on burnout outside of medical students. I can't say for sure whether the results from my master's research can translate specifically to like just university students overall. But there are multiple factors, demographic, movement, behavior related, that can place you at a higher risk for burnout.
Huh. Okay, wow. That's a lot.
It is a lot, yeah.
Okay, so I find it interesting that, well, with the third year group though, that sedentary movement, like people who reported more sedentary movement felt less burnout than people, like it's kind of curious there.
Yeah, and again, like it could be based on the year of study instead of actually the sedentary behavior. So like 1st to 2nd year medical students, they're more in lectures all the time, and more classes, less, well, they're not in clerkship yet, so more sitting. Maybe, you know, they still haven't had all the responsibilities of medical school necessarily pile up on them yet. So 1st to 2nd year students tend to experience less burnout. So they're sitting more, they have less burnout, but maybe it could be due to the year of study instead of actually the sedentary behavior. But it is interesting what we found. And yeah, it would be cool to do a follow-up study there.
Yeah, the third years just need a rest. They're like,
I agree. Yeah.
On their feet all day. Yeah, I guess so.
Yeah.
So you said that a lot of your research was mostly concerning medical students population, and you're unsure about translating it to other groups of students. But I'm wondering, do you think that there are any causes of I don't know, the burnout occurrences? Is it like stress, not enough movement? Does it? I don't know.
Yeah, there's a lot that can influence burnout, and I have looked into some of the literature on like other studies on medical student burnout and just studies on like burnout in general. So it's interesting because, you know, the factors I mentioned, at least the demographic factors, those are not really, you can't really change that, like whether you're, I mean, technically, actually, you can change. If you're born female, you can now change that. But generally, if someone is female, they don't, like, that's not changeable. Ethnicity that you identify with is not necessarily changeable. And there definitely are other factors that put people at a predisposition that may just be innate characteristics, like personality. So perfectionistic personalities have been pegged as sort of this risk factor for burnout. If you're always putting high expectations on yourself and don't take failures necessarily, which are inevitable, if you don't manage those productively, then that can place you at a higher risk for burnout. If you're just constantly trying to meet these higher and higher expectations. So there's definitely research that shows a link between perfectionism and burnout. You know, social support can also be really important for burnout. So again, if people feel isolated, that they don't have anyone they can really rely on, you know, if you're experiencing imposter syndrome, which is quite common in university students and medical students, that can place you at a higher risk for burnout. as well. And then again, like the movement behaviors, I think are a really important protective factor, like just making sure you're getting enough physical activity, but not overdoing it, and sort of listening to what your body needs.
Okay. And do you think that, I guess for most students, say that they have that high level expectancy of, I guess, their performance, do you think that, well, do you have any recommendations for them to avoid or limit the risk of burnout occurrence?
I think it can be really healthy to lower your expectations, which is really not easy to do. But it is doable. It's something that I was able to do. So I actually, the reason I got into burnout research is because I burned out in my first university program. So I actually, right from high school, went into this very competitive program, and burned out within the first 2 years, and then dropped out and decided to switch to kinesiology. So more about like health and well-being, which was a great choice. And then going into my master's again in human kinetics, I decided, I really want to research burnout because people need to know, and I need to find out, what can help people who are experiencing burnout or the after effects of burnout when it gets to be like to a really, really bad point. Because sort of I had rebounded from that and recovered, and I just wanted to, see how I could help others do the same. So I was able to lower my expectations, and it took some time, realizing that if I don't get an A on every single assignment, the world's not going to fall apart. I was still able to get into grad school with not A's all across the board. So I think that's a hard one to learn, but I think is really important if students can learn how to do that. So even like talking to your friends or your family to kind of work through maybe some negative feelings you might have about doing that, or some worries about lowering your expectations, talking to a professional if needed, can be really helpful. Sort of in that same light, if we are more self-compassionate with ourselves, that's a lot better way of relating to ourselves than criticizing. So being a perfectionist, you often criticize yourself for things that you don't achieve that you wanted to achieve. But if you can kind of take a step back and respond to yourself more kindly, accept any setbacks or failures that you've had, and sort of think about it like how you might talk to a friend. So if a friend got a worse mark on an assignment, you wouldn't tell them like, oh, you're so stupid, why would you do that, you should have worked harder, like this is the worst thing ever. You would probably say, oh, that's okay, like you'll do better next time. So we often don't talk to ourselves that way, and self-compassion has been shown in research to be really beneficial for burnout. So just responding to ourselves in a kinder way can be really helpful. And other related topics like mindfulness. Mindfulness is a component of self-compassion, but if you take that in itself, even mindfulness meditation can be really beneficial. So just like not attaching to your stresses so much, not sort of getting wrapped up in them and ruminating on them and having your stress be the center of your life, being a bit more mindful of it, using meditation as a strategy to sort of return to your breath, do some deep breathing, can help calm any stress and anxiety, and can be really helpful for burnout. So I think those are some tangible things that students can do with either little to no money spent. I mean, there's so many free meditation apps out there, and there's so much at our fingertips with Google and everything. So
awesome. Yeah. Being mindful about it is just key. Like you can't let stress determine the way you behave, right? Like, as you said, yeah.
It's easier said than done, but yeah, I agree.
Yeah. So do you believe that physical activity can also help in preventing burnout?
For sure. Physical activity sort of gives us an outlet to sort of expend our stress and expend our energy. I'm sure many of us have felt, the benefit of like putting our work away or just taking a break from whatever's stressing us out to go out for a walk or go play tennis with a friend or go for a run. whatever your go-to sort of physical activity is. So it can be really beneficial, and it doesn't even have to be like more intense forms. It can just be going for a walk. So anything really to just move your body, get the stress out of your body, sort of complete that stress response by expending that energy can be really helpful. So, I mean, I'm a huge proponent of physical activity and exercise.
Yeah. So I guess, well, you had mentioned that honestly, any type of activity is beneficial. And I'm kind of wondering, so what are the benefits of physical activity for students?
Yeah, there's honestly so many benefits to engaging in regular physical activity. You know, physical activity can be related to better resilience. It can help you regulate your emotions better. It can improve our mood, help us, reduce our anxiety, feel that we have better mental health. So people who are physically active tend to report fewer poor mental health days. It can also help lower our levels of psychological distress. So that would relate to burnout as well. Can improve our quality of life. There's so many benefits, not only for students, just for everyone. And that goes for, doing large amounts of physical activity that meet the guidelines. I would say relatively large. So like many people don't meet the physical activity recommendations of 150 minutes of moderate to vigorous physical activity per week, or of like several hours of light physical activity per day. So that includes standing, like standing, walking, doing chores. So many people don't meet that, and it can be daunting. But if you think about that, you don't need to necessarily meet the guidelines right away. If you can even just take small steps, doing that is better than nothing. And even doing, 5 minutes a day of something related to physical activity is still going to get you health benefits. And then just doing more after that can get you even more health benefits. So I think it's really accessible and good for us no matter what.
And would you say that there are any certain activities better than others, or?
I wouldn't necessarily say that. I think really it comes down to personal preference. Okay, so maybe two things I would point out are there can be special additional benefits to doing physical activity outside in nature versus doing it indoors. So you may have heard the concept of like green exercise. That can be a good way to combine both the benefits of connecting with nature and getting outside, getting some fresh air, getting some sunlight, ideally earlier in the day for sleep, combined with the benefits of doing physical activity. So that can be a really beneficial form. Another one, I would say if it fits your personality, if you're more extroverted or just want that connection with other people, doing physical activity socially with a group of people, so like intramural sports or doing physical activity with a friend, just having a walking buddy or a running buddy to connect with while you engage in activity. And in the remote context, that doesn't even have to necessarily be face-to-face. It could be like a distance walk, or if you're comfortable having that person in your bubble, doing like a closer walk, or you can just kind of chat over the phone with some headphones in while you're walking, or over FaceTime.
Awesome. Well, and I have a question about physicians and if they should be trained to prescribe physical activity to their patients. Do you think that there would be any benefit, or if that should be a thing?
Yeah, so it's interesting. Obviously, my research and my PhD fully centers around, the 24-hour movement guidelines in medical education and with current providers. So I definitely am a proponent of them knowing about the guidelines and being able to talk about them. In terms of actually writing a prescription for exercise, I think maybe if physicians are already doing that and are knowledgeable, have been trained appropriately in doing that, for sure, don't stop that by any means. But I think, and my work points to this, is that it should be more about having a discussion about the 24-hour movement guidelines. So many people who access like healthcare services and talk with their family doctors may not necessarily want to have a prescription for physical activity. They might not be ready for that. That might be overwhelming. So I think largely for that population, having providers just be able to talk about the guidelines, say why they're important, why they could relate to that person's particular life circumstances or health concerns, or the benefits that they could experience from engaging in the guidelines, the guideline behaviors. That's where the real benefit is. So sort of planting the seed, making sure that we're like widely disseminating this through physicians and other healthcare providers in Canada, that, these guidelines are something that are achievable and they can be discussed across the board. And then, coming from human kinetics, we all know the large range of benefits that working with a kinesiologist can give, or even personal trainers. And so those are other health professional populations who actually have substantial training in talking about exercise, in training about exercise, and in prescribing exercise. So if physicians and medical students can sort of learn more about just discussing the guidelines overall, maybe counseling on them a bit, like barrier management or action planning, but then referring to a registered kinesiologist as like the ultimate support for that behavior change, and really connecting that person with someone who has the requisite training. I think that's probably the best goal here.
Yeah. Well, that's it for all the questions. I think we covered a lot of content there. It's awesome.
Yeah, we did cover a lot. That was I'm always happy to have these discussions. I find them so important and so intriguing. Obviously, I wouldn't be doing research in this area for a PhD if I didn't find it interesting. So yeah, thanks so much for all your questions.
Oh yeah, and thank you. And like on behalf of EIMC, we'd like to thank you for taking the time today to meet with me and to discuss all of your knowledge and all your research on health promotion, and to share it with our audience.
Thank you for the invite. I'm very flattered, and yeah, was happy to help out.
Yeah, well, it was a pleasure speaking with you today.
You as well.